8 medications that can harm memory and brain health. Did you know that some commonly used medications could negatively impact memory and overall brain health? Many people aren't aware that some of the drugs they may be taking could contribute to cognitive decline. Imagine being able to identify and avoid these medications, potentially improving your quality of life. Research has shown that memory loss isn't necessarily an unavoidable part of aging. Rather, certain medications, when used without the appropriate guidance, can have serious adverse effects on the brain. But why do drugs that seem harmless often lead to such profound cognitive issues? And what steps can we take to protect our brains while managing other health conditions? Studies indicate that medications like proton pump inhibitors, PPIs, such as omeprazole and anticholinergics used to treat conditions like Parkinson's disease, are linked to a higher risk of dementia. Are we fully aware of these risks? Self-medication can amplify such effects, making the issue more concerning. Be sure to watch to the end, as medication number 7 on this list is surprisingly dangerous, and most people are unaware of its potential impact. Aging and dementia, a new perspective on cognitive decline. For a long time, it was assumed that dementia and other forms of cognitive decline were inevitable parts of the aging process. However, recent findings challenge this perspective, suggesting that memory loss does not have to be a natural or inescapable part of growing older. Dementia, including Alzheimer's disease, is actually the result of specific pathological changes in the brain, not simply advanced age. Research increasingly shows that, with the proper management of risk factors, it's possible to maintain sharp cognitive abilities well into old age. Many factors support brain health as we age, such as eating a balanced diet, engaging in regular physical activity, stimulating the mind socially and mentally, and managing chronic conditions like hypertension and diabetes. However, there are other lesser-known factors that can accelerate or worsen cognitive decline. For example, excessive alcohol consumption, smoking, brain injuries, strokes, chronic insomnia, and persistent stress are all well-known factors that negatively influence brain health. Additionally, nutritional deficiencies, particularly vitamin B12, as well as psychiatric conditions, play significant roles in cognitive health. Advances in our understanding of dementia have highlighted the impact of proteins like tau and beta amyloid, which form tangles and plaques that damage brain cells. Genetic predispositions can increase an individual's risk of developing dementia, though lifestyle and environmental factors can strongly modify these risks. Preventing dementia involves a comprehensive approach, including a focus on a healthy lifestyle, control of chronic diseases, and medical interventions when necessary. As research continues to explore new therapies to slow or even prevent dementia, the growing awareness that cognitive decline isn't inevitable can help encourage choices that promote brain health across the lifespan. Unexpected factors contributing to memory loss. Memory loss is a complex phenomenon influenced by various factors beyond aging and degenerative diseases. Some factors that can have a major impact on memory might not be as widely recognized. For example, substance abuse, including alcohol and tobacco, is a well-known cause. Alcohol can directly harm the brain, while tobacco use is associated with vascular issues that compromise brain health. Traumatic brain injuries, often resulting from accidents or contact sports, can lead to immediate and long-term cognitive challenges, such as chronic traumatic encephalopathy. Strokes are another major factor in memory loss, as they interrupt blood flow to the brain, causing damage that affects memory and other cognitive functions. Chronic insomnia and other sleep disorders are also closely linked to cognitive health. Regular sleep disruption can interfere with the brain's memory consolidation processes, making it more difficult to retain and recall information. Long-term stress is similarly detrimental, as elevated levels of cortisol, the body's primary stress hormone, can damage brain structures involved in memory, such as the hippocampus. Vitamin B12 deficiency is another lesser-known contributor to memory issues. This essential nutrient supports neuronal health, and its deficiency can lead to neurological symptoms like memory loss and mental confusion. Psychiatric disorders, including depression and anxiety, also have a significant effect on memory. Depression can reduce concentration and recall abilities, while chronic anxiety can disrupt the brain's ability to process and store information. Altogether, Memory loss results from a complex interplay of these factors, many of which can be managed or mitigated through awareness and intervention, which can help preserve cognitive function over time. Common medications that can damage memory. Many regularly prescribed medications are known to have potential adverse effects on memory and cognitive function, a fact often unknown to patients. Although these medications are highly effective in treating various health conditions, some carry significant risks of cognitive impairment. Below are 8 medications that have been shown to negatively impact memory and brain function over time. 1. Proton pump inhibitors, PPIs. Drugs such as omeprazole, commonly used to treat heartburn and acid reflux, fall into this class. PPIs, which also include lansoprazole and pantoprazole, work by reducing stomach acid production and provide relief from conditions like reflux and gastritis. However, studies show that prolonged use of PPIs is associated with a higher risk of dementia. For example, one study with around 6,000 participants found that 10% of people who took PPIs for more than 3 years experienced memory loss. Another study reported that 33% of patients using PPIs for over 4.5 years had cognitive disorders. These issues may arise because PPIs reduce the absorption of vitamin B12, a nutrient crucial for neurological health, and also affect gut microbiota, which can impact brain function. It's essential for patients to seek medical advice before starting long-term PPI treatment and limit their use whenever possible. 2. Anticholinergics. This class of drugs treats a variety of conditions, including Parkinson's, overactive bladder, and some respiratory disorders. Anticholinergics work by blocking acetylcholine, an important neurotransmitter for memory and learning, which is why prolonged use has been shown to increase dementia risk. 3. Corticosteroids. These powerful drugs, used to treat conditions from asthma to autoimmune diseases, can have severe cognitive side effects with prolonged use. Oral corticosteroids like prednisone and dexamethasone, especially when used over time, can lead to confusion, disorientation, and increased risk of dementia. Research suggests that corticosteroids may disrupt cortisol levels, affecting brain structures involved in memory. Inhaled corticosteroids, like fluticasone, also carry risks if used in high doses or long-term. 4. Benzodiazepines. Commonly prescribed for anxiety and insomnia, benzodiazepines like alprazolam and lorazepam are effective for short-term relief. However, studies show that long-term use of these drugs can significantly increase the risk of memory loss, cognitive decline, and even Alzheimer's. The cognitive side effects of benzodiazepines include impaired concentration, memory issues, and emotional dependency, making it difficult for patients to discontinue use. 5. Amphetamines. Widely prescribed for ADHD, amphetamines such as Adderall enhance focus and concentration, but can harm brain function over time. Extended use may lead to memory issues, decreased motivation, and, in some cases, permanent brain damage. The risk of misuse and addiction makes strict medical oversight critical for amphetamine prescriptions. 6. First-generation antihistamines. Drugs like diphenhydramine, often used to treat allergy symptoms, are effective but have strong anticholinergic effects that impair memory. Studies show an association between long-term use of these antihistamines and cognitive decline. Safer, second-generation antihistamines, like loratadine, offer effective symptom relief with fewer cognitive side effects. 7. Tricyclic antidepressants. Although these antidepressants, such as amitriptyline, are effective in treating depression, they can severely impair memory due to their anticholinergic properties. Studies indicate that prolonged use can lead to faster cognitive decline, particularly among older adults. Today, selective serotonin reuptake inhibitors, SSRIs, which have fewer side effects, are generally preferred for treating depression. 8. Statins, prescribed to lower cholesterol and prevent cardiovascular disease. Statins like atorvastatin and simvastatin have mixed effects on cognitive health. Some studies suggest a possible link between statin use and memory issues, though results vary. For those affected, adjusting the dose or switching to a different statin may help, along with lifestyle changes to reduce medication dependence. Self-medication. Risks and long-term medication use. Prolonged, unsupervised use of these medications can have serious impacts on memory and cognitive function. As highlighted, drugs like omeprazole, anticholinergics, corticosteroids, benzodiazepines, amphetamines, first-generation antihistamines, tricyclic antidepressants, and statins may contribute to long-term brain damage. It's essential for patients to consult healthcare providers before starting or continuing any medication. Discussing the risks and benefits, exploring safer alternatives, and staying informed about potential side effects are all crucial steps in preserving cognitive health. Thank you for watching. Don't forget to subscribe for more health insights, and we'll see you in the next video.